Welcome to Medicare 101 with MediWhat.Info. Now, Tracy and I have done a whole bunch of these meetings, and we just thought we might put one of these out so that you can see what we do in them. The only difference will be we'll be presenting the information, but we won't have your input necessarily. So feel free to put the comments in or ask questions or get a hold of us and ask us things, because we really would like to help you understand Medicare better. Now, when you start Medicare, there's usually one of four positions you're going to be in. Either you're on disability and you're already on Medicare before age 65, or you've started taking Social Security before age 65, or you're waiting till 65 and then you're going to take Social Security, or you're going to work past 65 and you want to know what you're going to do then. So let's address each one of those four. Now, the first one is you're already on a disability of some kind. It could be end-stage renal disease. It could be several different things that you might have. And you're on Medicare and you're not 65 yet. So when you get to be 65, you will have another opportunity during your IEP. Now, the IEP starts 3 months before you turn 65, the month of your birthday, and 3 months after age 65. So remember the IEP. So you'll have an opportunity at that time if you started taking, if you were on what's called a DSNP plan or a Medicare Advantage plan, and you're going, hey, that's not quite doing everything I want to, and I want to switch back to a supplemental plan. Well, you'll have a period during that IEP and then 6 months after you turn 65 to be able to look at a Medicare supplemental plan. And you really may want to look at that, because if your other plans right now aren't covering all your medical expenses and you're having problems with that, that's something we need to consider. So let's take a look at it. The other thing is you're on Social Security. You decided to take Social Security at 62 or somewhere in there, and you're wondering what's going to happen to you with Medicare. Well, what Social Security is going to do is that first month of your IEP, they're going to sign you up for Parts A and B of Medicare. Now, Part A has a $0 premium, but Part B comes with a $185 premium. So you need to understand that the first day of the month of your birth month, like my birthday is April 15th, so the 1st of April, my Medicare would start when I turn 65. They're going to start charging you that $185 a month, and it's going to come out of your Social Security check. So your Social Security check is going to get lowered by your Part B premium. Now, we'll talk about what you get with Parts A and B here in a minute. But what you'll want to do is you'll want to understand those, because they don't have any maximums on them. So you can pay as much as you're going to, as much as you can go. And there's ways to prevent that. There's ways to keep you from going bankrupt because of medical bills. And we'll talk about that. But you will be on Parts A and B automatically if you started Social Security before 65. And then during your IEP, let's talk. The third thing is you're going to take Medicare when you turn 65. Well, that first month of that IEP, that's a really good time to get started. You're going to contact the Social Security Administration. You're going to either do it through ssa.gov, or you're going to call them, or some way you're going to contact them, and you're going to say, I need to sign up for Medicare starting the first day of my birth month. And they'll say, okay, what do you want? You're going to say, I need Parts A and B. Okay, great. So what they're going to do is they'll sign you up for A and B. They're going to send you a Medicare card. And when you get that Medicare card and that Medicare number, then you're going to contact someone like us and say, okay, what else do I need? Because there's other things you're going to want to look at. You're pretty much covered at that. When you get your card in, give us a shout. The last one is you're going to work past 65. Now, this one you have to pay kind of attention to, because if you're going to work past 65, you want to work till 67 and draw your full Social Security, then you need to make sure that the plan that you're on at work is a credible insurance. So you're going to go to your HR department or your benefit administrator or whatever, and you're going to say, hey, I need to get a letter of credible coverage from the insurer that says that what we have at work is credible coverage as far as Medicare is concerned. Why is that important? Well, because if it's not credible coverage, then you could get some penalties charged to you that you don't want to get. And those penalties they charge aren't just a one-time thing. They go on every month for the rest of your life once you start Medicare. So you need to make sure that your insurance is credible coverage, and you also need to be working for a company that has over 20 employees. So if you're under 20 employees, you're going to revert back to I'm going to start taking Medicare at 65. One other thing that you may want to look at if you're going to work past 65 and you do work for a company that's less than 20 employees, you may want to look at something called an ICRA. And what that is that's a way that your employer can get a tax deduction, get you off of their insurance plan, because let's face it, at 65, we start to cost them more money, and they can pay a portion of your Part B. So you might want to take a look at that and see what's going on. Another consideration if you're working past 65, if you work for a company over 20 employees, and you have a HSA account. If you have an HSA account, make sure you've got credible coverage, and do not sign up with Parts A or B until you retire. Even though Part A is free, if you sign up with Part A, you no longer can contribute to that HSA plan. You can take the money out of it, but you can't get the tax benefits of that HSA plan. If you don't have a credible coverage, again, act like you're going to take it at 65. If you do have credible coverage, be sure and don't take Parts A and B. Talk to your HR department or your benefits administrator and make sure of all this, but you want to be careful of that. So if you have any questions about where are you at in one of those 4 stages and what you need to do, leave us a comment. Let's see what's going on. Now, how do you get on Medicare? Kind of covered that a little bit. The first thing you have to have is a Medicare card, a Medicare number. Like I said, if you're on Parts 1 or 2 of those where you're already on Medicare, they're going to sign you up. They're going to send you a card with the number. If you are going to take it at 65, you need to contact Social Security 3 months in advance and get that card. If you're going to work past 65, don't worry about it. And if you're working for a company that has credible coverage, don't worry about it until you retire, as long as you have at least 20 employees in the company. If you have less than 20 employees, you probably want to go ahead and contact Social Security and get on Medicare and get that card. So once you have that card, then you start trying to understand, okay, I got this card. What's this mean? Now, a lot of people think, oh, well, I've paid Medicare taxes all my life, so I'm going to get Medicare for free when I turn 65. That's what I thought. And then we started looking at this stuff, and I found out, no, that's not true. Number one, you're going to pay that Part B premium of $185, but then there's some other things about it. So let's break that down. Medicare, basically, original Medicare is Part A, and there's a Part B, and there's a Part D. Now, notice I left off Part C. Part C is a different animal. It's called Medicare Advantage. We will cover that. But for right now, let's understand Parts A, B, and D. Part A is hospitalization. So if you go to the hospital and you're an inpatient in the hospital, and you're going to get a deduction or a deductible of $1,632 that you have to pay per incident. You can have more than one incident per year, so it can cost you more than that $1,632. If you spend more than 60 days in the hospital, they start to have a copay for the next 60 days. If you go past that, you may have to pay the entire bill. So there's no maximum on that. So you have to be very careful of it. This also covers hospice. It covers skilled nursing, covers home health. It covers several different things, but there's some expenses in there that you need to be aware of moving into Part A. Even though the premium is $0, there are some costs. Part B this year in 2025 has $185 a month cost. So what you're looking at there is you're looking at your $185 a month, and then what it does, it has a $257 one-time deductible. So once a year you're going to pay the $257 deductible, and after that, Medicare is going to pay 80%, and you're going to pay 20%. The thing about that 20% is there is no maximum. So if you go in and you have a major bill, then let's say it's $100,000, you're going to be on the hook for the $20,000. There's no max out of pocket on this, so no max. And when you consider how much, and thank you, Tracy, I left that out. This is doctors. Part B is doctors and outpatient. So there's no max on either one of these two. And the reason we talk about hospital and we say outpatient, you need to understand something here. If you go into the hospital, if you had a heart attack and you have to go to a hospital and they say, okay, we're going to ship you to another hospital, you ride in an ambulance to the other hospital, you get there, they do EKGs, they check you out, all that kind of stuff. And finally, several hours later, somebody comes in and says, okay, we're admitting you into the hospital, you're now an inpatient. Until they make that comment that you're an inpatient, all those charges before, the first hospital, the ambulance ride, all the stuff they've done at that hospital, until they say you're an outpatient or an inpatient, that's all Part B. So on all of that, you're paying 20% of all those costs. Ambulance rides, past experience, can be kind of expensive, $3,500, $5,000, somewhere in there, 20%. It's some money. And that's not including what they do all the other time. So you've got some big expenses here that you might want to cover and consider covering. And in fact, 93% of the people in America 65 and over do choose something in order to cover these expenses. And we'll talk about that in a second too. Part D is your prescription drug plan. Now, on the prescription drug plan, what you'll do is you sign up for a plan. Somebody like us will take all of your medications and we'll want to look at them, and we'll want to make sure that you stay in network as much as possible. Why is that? Well, in network pricing or preferred network pricing, standard network pricing, whatever they want to call it, gets you a lot cheaper price on your medications than if you go to somewhere that's out of network. So when you have your stuff, we're going to take and look at all your prescriptions. We're going to see where they are. We're going to see how they, where you're getting them from, and help you find where to go to get the best price. We're also going to look at those prescriptions because some people, some carriers will have one drug and what they call a tier 1, tier 2. That's not going to cost you much money. And it doesn't count towards a deductible. And this has a $590 deductible on it every year. So tier 1, tier 2 doesn't have count to that. Kind of cheap, doesn't matter. Another company may say, hey, that tier 2 drug, we think it's a tier 3 drug. Now it's going to be part of that deductible, so you're going to have to pay your deductible before it'll start anything paying on it. And then it's a higher cost than if it was in a tier 2. Tiers 4 and 5 get even more expensive. And in some drugs, one company carries it in what's called their formulary. Another company doesn't have it in their formulary. Well, if carrier doesn't have your medication in formulary, then it doesn't count at all towards any of this. If they do have it in formulary, the good news is there's a $2,000 max that you'd have to pay in a year's time. That's the most you would pay. And we just need to look at all that and be really sure that we get everything together so that you don't have any hidden costs or hidden surprises. Part D does have premiums. It could be anywhere from $0 to a couple of $100, depending. Sometimes a $0 plan will cost you more in a year than a $200 plan will cost you in a year, just depending on how they handle your medications. So, and where you buy your medications. And then every year, we're going to want to reevaluate this and take a look during what's called AEP. Starts in October 15th, lasts through December 7th. We'll want to go through and reevaluate and look at your medications and make sure that you're solid for the coming year. So anyways, that's parts A, B, and D. If you have any questions on those, please leave them in the comments and we'll be glad to get to answer you. So let's continue on. This is original Medicare. Now you would think, well, okay, so now I've made my decision when I'm going to take Medicare, and I'm going to be on parts A, B. And I know I got to have prescriptions. And oh yeah, on the prescription part of it on part D, you have to have credible coverage all the time after you turn 65. If you go 63 days and you don't have credible coverage, what they do is they start charging you a 1% penalty. And that 1% penalty per month can add up to a lot of money. If you go 10 years, you may be paying $35, $40 a month extra for your prescription drugs when you finally do get a plan, and you pay that the rest of your life. So we need to be careful of that penalty. Also, with the Part B that we had up there, it has a penalty as well. You may say, I'm perfectly healthy. I'm not going to sign up for Medicare. Fine. If you go a year without coverage on Part B, and then you decide to sign up, they're going to charge you 10% penalty for the rest of your life every month for Part B. So instead of $185, you can tack on $18.50 to that. So now it's whatever, just around $200. If you go 2 years, they're going to charge a 20%. If you go 3 years, a 30%. So, and those penalties don't go away. So on Part B, we really have to make sure that you're covered on there, especially if you're working past 65. We want to make sure everything's okay. When you sign up, you're getting Part A and you're getting Part B. Folks, I don't care if you do a Medigap plan or if you do a Medicare Advantage plan or what you do. You're always going to pay Part A and Part B. Those don't go away. You see those commercials on there that says you can have this for $0 a month. You're still going to be paying that Part B. That doesn't do anything to that. Now, once I've said that, there's a way to offset these things. There's two ways. One is you can get a supplement policy, also called Medigap. Or you can do Part C, which is also called Medicare Advantage. A quick breakdown, a quick little difference on these two. The Medicare supplement, Medigap plans work with original Medicare. So you go to the doctor, you go to a hospital, you go wherever. Your doctor is going to send your bill to original Medicare. Original Medicare is going to pay the parts that they're going to pay, and then they're going to send the bill to the carriers you've chosen for a supplement plan, and they're going to pay the rest of any covered expense. Now, there's two types of plans you can get. There's a Plan G and a Plan N right now. Plan G will cover everything except for that $257 deductible. Has a little bit higher premium. A Plan N has a little bit lower premium, but it does have some co-pays and there's some things on there. And it kind of depends on your situation which one of those two you would want to go on. But the main thing is you don't really see the bills. They go to original Medicare, then they go to the carrier. Part C, it replaces everything on Part A, B, and usually D. So over here, it's private insurance companies. The government is going to pay the private insurance companies. You're going to choose a private insurance company. It may have low $0 premiums. It may have some perks. It may have some things like that. So it might be something you want to consider, but you'll need to remember it replaces these two. So instead of you being in charge over here, you and your doctor being on charge, insurance company is going to be in charge of your health. You want to pay attention to that, and it may matter to you, it may not. All right. Over here on this, premiums. Now, these Medigap plans have a premiums typically between $110 a month to about $190 a month. Somewhere in there, depending on your area and how they have your county. All of these things are priced per county. All Medicare Advantage plans are judged by county. So I can't really tell you what the price is, but it's going to fall somewhere in that range. Over on this side of the fence, for a premium, you may have $0 or you'll have a low premium, depending again upon your county. So a lot of people look at that and they're going, "Hey, I'm going on retirement. I'm going on a fixed income," and they'll look at that $0 and they'll say, "I can afford this and eat a whole lot better than I can afford this and not eat." So it kind of depends on your situation, which one of these two you're going to go. But remember, zero is not always free. Networks. Now, on networks, I'm going to put none. And the reason I put none on this side of it is because for Medigap and supplemental plans on networks, you can go anywhere that accepts Medicare in the United States. So if they accept Medicare, you can go to them. It doesn't matter. And you're going to get charged the same, or not charged the same. It's going to be treated the same regardless of where you go in the United States. They're going to bill original Medicare. Original Medicare is going to turn around and build your plan. That's just how it works. So there are no networks. You go wherever your doctor says go. You do whatever your doctor says. Over here for networks, there are networks. In fact, there's two kinds of networks. There's what's called an HMO, and there's also called a PPO. Now, if you live in the city, HMO plan might be okay, because where there's large concentrations of people, there's usually large concentrations of medical facilities, and these things have smaller networks in a geographical area. So, but they're also less expensive. And what happens is, for an HMO or a PPO plan, the government pays for your Part C. They pay these doctors and these and facilities that are members of these different plans, they pay them up front a portion of the bill. So they're making money whether you go to the doctor or not, so they can charge less. But on an HMO plan, it's very specific, and you have to be inside the network in order to use it. Works well in the city, doesn't work so well out here in rural Texas. A PPO plan has a larger geographical area. With a PPO plan, the costs are typically more expensive. Your out-of-pocket costs can be more expensive, and your max out-of-pocket can be more expensive on a PPO plan. But you can also have a wider area of doctors and hospitals and things that you can go to. So when you're looking at one of these plans, you really need to sit down and look at what facilities do I think I want to go to. You also need to understand there are some facilities that can say we don't want to take a Medicare Advantage plan. If they do, they don't say this about supplemental plans unless they say we're not taking Medicare at all, and that's pretty rare. The reason being is, over here, bill the government bills the carrier pays. Hospital gets their money, doctor gets their money. Over here, you go in, they have to bill the carrier, and the carrier has to decide and go through and look and say, is this what we're supposed to pay? How are we supposed to pay? And they have some say over it, and hospital stuff don't always like that as much. Referrals. Over here, there are no referrals. If your doctor says, I want you to go see this specialist, that as long as they take Medicare, that's who you go see, you're covered. On referrals, you have to go to your primary care physician. The primary care physician has to make a referral for you to go to a doctor, and then you can go see them. So you have to go through a chain to get to referrals. It's not just a doctor saying okay. One other thing, if you go, let's say your knee's bothering you, and your doctor says, I think you need to have knee replacement. On this side, you go have knee replacement. On this side, the insurance company does have the right to say, I think you need to do physical therapy first. Let's do physical therapy for 6 months, and then we'll see if you need to do knee replacement. You may agree with that. You may not agree with that. You might be okay with it. That's personal choice. But anyways, on referrals, over here we do have referrals. And then max out of pocket. I'm going to say none over here. And the reason I'm going to say none on the max out of pocket is because whatever you're paying on this premium, that's how much you're going to pay during the year, plus the $257 Part B deductible once. On this side, you're going to have co-pays and co-insurance. If you have to go in the hospital, you're typically going to pay $350 to $450 a day for the first 5 to 6 days. If you go to the doctor, you're going to have a copay, $20 or $30 to go to a regular doctor, usually around $50 to go to a specialist. Everybody that comes in and sees you is going to have what you're going to do for your copay. So the copays and the co-insurance can add up pretty quick, but if you stay in network, typically, if you stay in network, your max out of pocket is going to be somewhere around $3,500 to a little less than $8,000. If you go out of network, your copay is going to be somewhere usually between $10,000 and about $14,000. This is the max out of pocket on here. That's one reason we want to be really sure, if you decide to go this route, that you stay in network, because the price differences can be quite a bit. But you still, with an HMO, you don't go out of network unless it's an emergency. They may not pay anything if you go and it's not an emergency. With a PPO, you can go just about anywhere it takes a takes Medicare Advantage, and they will pay the out-of-network price, but you're going to pay quite a bit more money. So that breaks down kind of the differences in parts A and B and supplement versus part C. In our experience, kind of what we see is in rural areas, a lot of times supplement's the best way to go. It'll save you money in the long run. But a part C plan, you can't eat that premium. You may be perfectly healthy and say, hey, I don't care about it. This is kind of the way my normal insurance runs anyways. I want to stay right here. Sorry, chicken just scared me. So stay right there. You can do whatever you want to. Doesn't matter to us as long as we make sure that you have all the facts that you need and that you understand everything. If you like what you've seen, subscribe to our channel. We'll have more videos. If you like it, click like. Hey, help us spread the word on Medicare and help keep people informed. You'll be helping your neighbors. Y'all have a great day.